I'm Annette, and this is Dana. We're Wound Care in Hammond. And so today we're going to talk about our protection, prevention, and treatment of skin, root, and wounds. And we start out with a mission, of course. And so our nurses do a 2-nurse skin assessment, and that's accompanied by a dot smart phrase. Okay. And then they are also able to take a picture using the iPhone with the robot app, and they take an admission picture. They generate a referral to wound care, and then we come to see the patient. As the patient's admitted, a couple of things that we like right off the top is to keep the linens minimal on the bed. We like only 3 layers, and we start with a fitted sheet, a draw sheet, and an ultrasor pad. If we have a patient that is hard to move, larger, we would use an Angel Glide, and these are carried by our housekeeping department. So there are a couple delivered on every linen cart every day, and if we don't have them, we do call housekeeping, EBS supervisor, if we need to have more on the unit. They very much help with raising patients in bed, turning them. They're made out of a parachute type material, and it decreases shearing on the backside skin of a patient when you're trying to move them up in the bed. The reason that we like to limit to 3 linens on the bed, there's 2. And one is to control the microclimate, which means that if you have more layers on, the patient will become warmer, there will be more moisture and sweating. This can lead to more fragile skin and skin breakdown. And then the other reason is that the more layers between the patient and a therapeutic mattress, it negates the effectiveness of the therapeutic mattress. So the 3 layers work is perfect. Once we have our patient in bed and settled with their 3 layers, we have our prevention items that we have. We have a wedge and a turning wedge and a heels up cushion that we like in every room. So each patient has that available for offloading and for repositioning. We also carry the waffle chair cushion, which we use in the chair, and the versatility of it is that we can also put a pillowcase on that and use it as a pillow if we need pressure relief for head or ear wounds or new trachs. We also have topicals that we use, and they all work together. So we have an incontinence cleanser, we have a skin moisturizing cream, we have also a moisture repellent cream. We would use the moisture repellent cream if skin is intact and we just have very minimal moisture issues. Then if we have a lot of moisture issues and we want to create a barrier to heal, we have Cavalon Skin Barrier. This will be used, we can use it on skin that is irritated by incontinence or moisture. We use it on peri areas, we can use it on buttocks, we use it around trachs that are very moist, have a lot of secretions, the skin around them to protect it. It behaves as a second skin. So once we apply it, one thin film overlapping layer to the affected area, let it dry 30 to 45 seconds, and then we've created a second skin so that the skin underneath has time to heal while this barrier repels any extra moisture. And the nice thing is that we can apply it just every other day. The nurses do this and keep track of what day to reapply. And we don't use creams or powders with it because then it cancels out the effectiveness of it. Those are our topicals. We have some basic wound dressings that we use very frequently, silicone dressings or a leave-in. And we have 3 sizes, large, medium, and a 2x2 or baby. And they're very versatile because they can be used on a sacral area for protection for someone who is at high risk. They can be used as a protective dressing over a stage 1 redness or DTI or bony prominence. And they can also be used as a cover dressing if we have to pack a wound and then apply a leave-in over it as a cover dressing. 2 other dressings that we like to use frequently are both very absorptive dressings. One is algicite, and it's made from seaweed. We use this very much for draining wounds as it's very absorptive. And then the blue hydrophera is a foam dressing that's also very absorptive, and we do like to use that, and it's quite versatile. We can use it as a drain site dressing. We can use it underneath a trach plate. We like to use it on ulcerated legs and wrap with Curlex. Very versatile dressing with antimicrobial properties. And these would be used as a daily dressing change with a cover dressing as well. And the other thing that we brought in as a protective is Protected Gel, which is in use when a patient is using BiPAP. When they're on BiPAP, this silicone conforms to the bridge of the nose and the cheeks and is placed underneath the mask. This helps to protect that area from breakdown. In the event the patient needs to be on constant BiPAP, we also have a fireman mask, and our respiratory team takes care of alternating the traditional BiPAP mask with the fireman mask, and that fireman mask encloses the whole face so that we have no pressure on the nose and the cheek area. We also have foam ear pads that we can use under our tubing on the ears. The ears we forget to look at, and they're a very important part of the body that can break down easily from oxygen tubing and medical devices. So it's a good idea to frequently check your patient's ears, especially if they're using oxygen. And we converted our oxygen tubing to silicone, which is much skin friendlier. However, our high flow tubing still does remain as a hard tubing, and so the foam ear protectors can be obtained from respiratory, and they're placed under the tubing to protect the ears. Wound care as well, we can always be reached by Vocera or by putting an IP wound consult in the computer. We take care of back dressings, we maintain them, and we take care of the patient until they're discharged with their back. We also have specialty beds at all the campuses. Our specialty beds are available by calling the EVS supervisor, housekeeping. We have specialty beds, bariatric beds, and low air loss P500 and Centrola Max beds. When we call the housekeeping, we can ask them to bring it to the room, staff will switch it out, and then when the patient is discharged, we can call housekeeping once again to take that bed away, clean it, and put it back in storage. This helps us greatly with decreasing our rentals of specialty beds. So we would use those, our Acumax Quantum here in Hammond. We've recently got new mattresses. They are a therapeutic mattress in themselves, but they are related to movement of the patient to relieve pressure. If we have high risk or a patient with wounds, we would go to the specialty bed, and in some cases we would rent an Envision specialty bed if called for. I think we've covered everything that we need to. If you ever have any questions though, you could always call the Vocera, your wound care specialist, and we're available Monday through Friday.